My name is Christine Vatovec, and I study the unintended consequences of medical care on the environment, including pharmaceuticals in Lake Champlain. In 2017, Consumer Reports did a national study, and they found that in the past 20 years, in general, Americans are taking 85% more prescription drugs than they had 20 years ago. So there's a lot more prescriptions out there in our community. We're looking at this to try to understand what's happening in the environment. How do these pharmaceuticals actually impact the environment out there in ways that we haven't really thought of before, or that hasn't become widely acknowledged. Algae and zooplankton and fish and waterfowl, lots of different species in all these categories have been tested and found to be containing and bioaccumulating pharmaceuticals. Some studies have shown that this is changing behaviors of different animals out there in the environment, and changing their reproductive behaviors, changing their feeding behaviors. In some cases where people have actually done experiments in small lakes and small ponds out in the natural environment, adding different chemicals, we've seen complete population collapse of fish species. So we don't really know what that means for human health, but we know that just this past year, another national reconnaissance was done for the United States. They tested 25 large municipal drinking water systems, and they detected pharmaceuticals in 100% of the samples. Starting a dialogue with your pharmacist and with your physician can help to both educate them and make people more aware in general about this environmental problem, but also start looking for some of those other ways that we have that are very evidence-based in supporting health in ways that don't need chemicals.